Okay, great question. What about H. pylori? What is H. pylori? Who cares about H. pylori? What should we do about H. pylori? What about gastric ulcers and gastric cancer? Well, H. pylori is a bad bug. In fact, it's part of the Nobel Prize that was awarded for medicine last year, because a couple of wacky Australians said that gastric ulcers and duodenal ulcers came from a bacteria. Okay. The doctors in the United States and around the world were so upset over that they were going to go down and throw them off the island. Because these guys said that bacteria cause ulcers. And we said, everybody, all the doctors, we knew what causes ulcers. What causes ulcers? Acid. Well, they said, but everybody has acid. How comes everybody doesn't have ulcers? And so people were really upset, and for a long time we thought they were crazy, and so they did a great test. They endoscoped themselves.
Sorry.
They put an endoscope down their throat, and they looked at their gut, and they biopsied the area, and they showed that they did not have H. pylori. Then they ate some H. pylori. These Australians. And then they came back and endoscoped themselves again. And they had gastritis, and they could biopsy it, and they found that they had gotten ulcers from the H. pylori. Then they took antibiotics that killed the H. pylori, and they endoscoped themselves again, and the gastritis went away. So for that, they got the Nobel Prize last year in medicine. Because they changed. We believed one thing, as all of us doctors believed, and they completely changed what we believed. Huge difference. Okay, so now we know that H. pylori causes ulcers or is associated with ulcers. But in their case, they put it in, caused an ulcer, antibiotics, ulcer went away. Okay. So what if we just go ahead and get rid of everybody's H. pylori? Would we get rid of all ulcers? Well, it turns out between a half and 2/3 of us have H. pylori. So we'd have to treat a lot of the country to get rid of the H. pylori. And some people think that might be a good idea in some places because H. pylori is also associated with gastric cancer. But at the present time, there isn't any standard recommendation that we should all be treated for H. pylori. And since it's pretty common, should we all be treated? And if a lot of people have it, should we? So it's not a bad idea. Maybe we should all be treated for H. pylori. I'm not opposed to it, but the present recommendations are that we don't have to do it. Some bariatric surgeons go out of their way to biopsy, test for, and treat H. pylori. And I don't think that's a bad idea. But what we found is sometimes patients get ulcers and they have H. pylori. Sometimes my patients get ulcers and they don't. And either way, we treat them about the same. So we wouldn't be opposed if, for example, you and your medical doctor wanted to get together and look for H. pylori. In general, the national recommendations are not that we find every single person in the country, get them an endoscope, or do a blood test, or look for H. pylori and treat them. If you did that, would you maybe protect some people from gastric cancer? Maybe. Can you get reinfected afterwards? If we treated the whole country, would we have a lot of resistant H. pylori? So right now, I don't know the right answer. I would say most of our patients do fine. If our patients have symptoms of gastritis or an ulcer, we treat them initially just with Prilosec, and then only after that, if they don't get better, do we use the antibiotics for H. pylori. And we do that, and we find that, less than 5% ever go on to the antibiotics, and we don't endoscope everybody, we don't biopsy, we don't test for H. pylori in everybody. If I were to take all my 5,000 patients and biopsy and test and treat, would I have a few fewer ulcers or gastritis? Maybe. But I don't do it, and I don't feel driven to do it, and so if, for example, you and your doctor said, we want to do it in your case, I wouldn't be opposed to it. There are places in the world where they have very high rates of gastric cancer. in South America. There happen to be some locations in Japan. And so they have said gastric cancer here is sky high. In the United States, gastric cancer is going down, has been going down, and continues to go down. And around the world, the more advanced your society, the more you have access to refrigeration and healthy foods as opposed to contaminated foods, the rate of gastric cancer and H. pylori infections are plummeting. In some areas where they have poor people, they have poor sanitation, and in Japan, they have high rates of gastric cancer, and they've actually gone down and done some anti-cancer things, like just giving some vitamin C. Vitamin C helps protect against gastric cancer. They've given antibiotics. That, in a similar group of people in South America, has decreased their rate of gastric cancer. But the antibiotics and vitamin C worked equally well. So that's where you get back to our advice to eat a healthy diet and some vitamins. Could we also give antibiotics, or should we look for H. pylori and give antibiotics? Right now, the national recommendation is for an asymptomatic patient, we don't go out and endoscope, biopsy, and treat everybody. Could we or should we do it like a national look for H. pylori in everybody? I don't know. Should we do it just in my patients because of the risk of ulcers? I haven't, and I'm not convinced that it would help, but I wouldn't be opposed to it if somebody wanted to.